Hi, I'm Theresa Sullivan. I'm one of the senior staff nurses, and we support patients and families with their symptom control and with supportive care to help improve their quality of life. During COVID, this was particularly difficult, especially because the best medicine sometimes for patients is their families, and it was difficult to involve families in our care. We came up with some unique ways. Our team worked with developing hearts that the patients could actually give one to their family member to take home and keep one as kind of a symbol of that they were still connected to their families. Sometimes families gave them to the patient and did the same thing. But that really helped a lot of families, especially with younger children, symbolize that they were still connected during that time. We also had special stones that some of the team came up with. So they were painted by volunteers, and then families could leave messages on the back, and they kept them in the patient's rooms. Again, just kind of a symbolic connection that they were still involved. We did a lot of bringing patients and to their families through the garden. So families would enter through the garden and be able to see their loved ones and interact with them, but in an atmosphere that allowed for the guidelines to be followed. We also got into technology, and we had special Skype tablets that patients could then talk to their families. And I know some patients in particular use these, especially when trying to connect with their loved ones at home. And we also, our team developed guidance that we could give out to patients and their families about the visiting and about all these different options that we had for them. So between the comms and the volunteers and the nurses and the aides and everybody working together, we were able to help families still be part of our care here at the Peace.